Let's first start talking out by which particular nerve fiber properties are associated with which kind of nerve. Muscle afferents, these are the ones leaving the muscle going up towards the spinal cord and eventually the brain. In the muscle we have a couple of classifications. The first are muscle spindles. Muscle spindles have two classes associated with them. Their primary nerve endings are 1A sensory fibers, and their secondary endings are type 2 sensory endings. Their conduction velocity is different between these two. The primary ones have a faster conduction velocity, somewhere between about 80 to 120 milliseconds, versus a slower 35 to 75 with the type 2. Golgi tendon organs. These are classified as 1B sensory muscle afferents. They have a fast conduction velocity, 80 to 120 meters per second. Therefore, they are very similar in their speed to the 1As. If we now look at muscle efferents, so these are now going to do something like a contraction, going from the brain to the spinal cord to the muscle. Alpha motor neurons also have a very fast conduction velocity, 80 to 120 meters per second. Gamma motor neurons, also known as intrafusal fibers, these are slower, only 15 to 30 meters per second. So that brings up there's a difference between extrafusal and intrafusal fibers for muscle afferents. Extrafusal fibers are the traditional alpha motor neurons that are going to cause muscle contraction. These intrafusal neurons, gamma-mediated class, they require us to talk through a little bit more because they're associated with muscle spindles. Muscle spindles. Muscle spindles are located within the belly of the muscle. There are a couple different types. One are nuclear chain and the other are nuclear bag fibers. These nuclear chain and bag fibers respond a little bit differently to stretch. Muscle spindles stretch, always stretch. Here what we want to think about is stretching a fiber, the primary nerve endings. These are the ones that are the 1As. They will fire very fast in response to a change in length. If you look at the secondary fibers, these ones will also increase their firing frequency, but they do so not related to the speed of change, but rather to the new length they are at. So the 1As respond to rapid changes by having a volley of spikes right when the change happens, and the secondary ones, these will change in regard to length changes. So you can see how stretch has multiple components. There's a speed at which the muscle stretches, and then the end amount of stretch the muscle has undergone. So if you think about these being protective fibers, when there be a time when the muscle could stretch too much? Well, if it's stretching too fast or it's stretched too far, you may need to adjust the muscle contraction to make sure damage doesn't happen. That is what the myotatic or stretch reflex does. You use a reflex hammer to percuss a tendon. This tendon causes a very rapid stretch of the muscle. This rapid stretch of the muscle causes an effect. It's sensed by muscle spindles. So this is all a muscle spindle response. It sends their information via the muscle spindle through the sensory afferent nerve back to the spinal cord. At the level of the spinal cord, you get a reflex that happens. That reflex involves two things. One is you will get a contraction of the muscle being stretched, and the second thing is you will get a relaxation of the opposing muscle group. So if we were using this example that you see here, you'll see that the quadricep will undergo a contraction. So this will be a shortening. And then the flexor, which is the hamstrings or semimembranosus or tendinosus, that will be relaxed. Golgi tendon organs. Golgi tendon organs are located in the muscular tendinous junctions. Now, in the tendon or muscular tendinous junctions, there's not much stretch that happens. Stretch is what's being sensed by muscle spindles. Tendons sense tension. So tendons sense tension. How much pull is being applied to that particular tendon or musculotendinous junction. They work via a class 1B afferent, so they move very fast back to the spinal cord. The reflex that's engaged by GTOs, or Golgi tendon organs, involves a protective mechanism. So if a muscle is applying too much force, and that is pulling too hard on the tendon or musculotendinous junction, there is a reflex that happens to reduce the muscle contraction and therefore prevent the tendon from rupturing. So this response is sensed by the Golgi tendon organ, sent by the 1B fiber back to the spinal cord. The spinal cord then synapses with an inhibitory neuron to the alpha motor neuron to decrease force output. The other thing that this particular reflex does is also strengthen or contract the opposing muscle group. So the opposing muscle group is what is on the opposite side of the bony lever. So in this case, you might have a contraction of a muscle like the biceps, and therefore your Golgi tendon organ is sensing too much strain or tension. It is going to reduce the amount of constriction to the bicep. But at the same time, it is also strengthening or engaging contraction in the triceps. So again, to prevent that tendon from becoming too stressed and potentially rupturing.